Okay, I think we should begin. Good afternoon, everyone. Welcome to session 16. My name is Gambhir Bhatta. I'm currently a consultant for the ADB. Took early retirement when COVID hit and spent time in New Zealand. That's where home is. And before I left at the bank, I was the chief of the governance thematic group and an advisor in the Sustainable Development and Climate Change Department. I'm glad to be here. I wasn't supposed to be the moderator for this particular session, but there were a few changes that took place, including the lead presenter, Svetlana, who couldn't be here in person, but she sent us a taped presentation. So I'm filling in for others that would have done this role. The session focuses particularly on the subject of evaluating regionally for what's called international public good. And this notion of a public good has been raised oftentimes in the days that we've been here. So this session actually carries that concept further, and you'll hear from three colleagues, four if you count Svetlana as well, about this notion of what a public good is, how do you evaluate, and more importantly, what are the implications for the international public good being evaluated at a regional level, and then how do you generalize to a bigger audience. The particular session here actually does take the concept further with respect to the work of the CGIAR. The CGIAR is the consortium of international agricultural research centers, and the work that it carried out in 2022 to 2024. As you know, it seeks to deliver science and innovation that advance the transformation of food, land, water systems in a climate crisis. And because of the focus that we've had on agriculture in today's session, and we have colleague from EDB, Garrett, who presented that, this is a really critical issue. And so it's a topic that I think resonates with many people that are working in this area. The CGIAR has three science groups, and they've done a lot of substantive work. But one of the questions that they faced was, what's the likelihood of the science group research portfolio generating, again, what we call international public goods? So the session is structured around that particular concepts. I'll briefly introduce all the speakers along with the topic and who they are, and then I will then proceed to hearing from them individually. So first, Ms. Svetlana Negroustoueva, who is not here, as I said, but has instead sent us a taped presentation. She'll talk about the evaluative evidence from the three science groups of CGIAR on international public goods. Svetlana leads the independent evaluation function of the consortium. She has more than 20 years of experience working with the World Bank, the AFDB, and specific M&E activities of UN agencies, NGOs, bilateral agencies such as the DFID. And she has a master's degree in public affairs from the University of Texas. She'll be followed by Dr. Cristiano Rossignoli, who will be sharing with us the WorldFish experience with impact assessments in the area of aquaculture, and with a case study of this in Bangladesh. WorldFish has proposed an aquatic food research initiative to support data-driven approaches and establish a strong evidence base to improve the sustainability of aquatic food systems. Again, an important topic in light of the focus that we've had on food systems, food security, and other such issues that we talked about this morning. Cristiano leads the CGIAR initiative on aquatic foods and serves as the MEL and impact assessment research leader for WorldFish. Over 15 years of experience specializing in impact assessment and monitoring and evaluation. He has held significant roles at the University of Pisa, FAO, and Oxfam, and contributed to food security initiatives in various countries. Currently a visiting researcher at the Institute for Future Initiatives at the University of Tokyo, and has a PhD in agricultural economics from the University of Pisa. After Cristiano, we'll then hear from Dr. Moogdho Mahzab, who will talk of the Bangladesh Integrated Household Survey as a global public good. And in that regard, he'll also be sharing some results of the randomized control trials in Bangladesh. Now, we've heard a lot about the RCT. If you remember, even on day one, Tim was talking about it, and almost everybody over here has talked about the importance of the RCTs and how you generate evidence. But sometimes we think we know what it means, but not necessarily. So this is something that I come back to because colleague Tara will be talking about that as well. Moogdho is an associate research fellow with the Poverty, Gender, and Inclusion Unit of the International Food Policy Research in Unit IFPRI. It's based in Dhaka. He's a development economist with research interests in environment, health, and political economy and governance. Prior to joining IFPRI, he was a postdoctoral fellow at Stanford Graduate Business School and Stanford Woods Institute for the Environment. He was a Fulbright scholar from Bangladesh, but also received his PhD in economics from the University of Virginia. Finally, Ms. Tara Marwah's presentation, which is titled Around the Generalizability Puzzle, Working Around the Generalizability Puzzle. And it is really a puzzle, because the question then really is, if you've done this over here and you've piloted something over here, you've done a research and you come up with something, how generalizable is it to the bigger space? And that's a key part of any evaluative work anyway. And so it should be focused on that particular topic. And again, also on the randomized control trials, so she will be actually explaining to us how the RCT thing works and what it means for purposes of generalizability. Tara is a senior policy manager at Innovations for Poverty Action in the Philippines, promoting evidence-based informed policy. Prior to joining IPA, Tara worked as a senior policy associate at JPAL, and before that in Rwanda as a project manager and also as a consultant for the German Development Bank, KfW. She has also had professional experiences at OECD, holds a master's degree in international trade, finance, and development from the Barcelona Graduate School of Economics. Now, we're hoping the presentations will be about 20 minutes for Svetlana and for Cristiano, because you are doing the lead presentation and the case study, in about 15 minutes or so for our other two colleagues. What we'll do then is go with Svetlana's presentation first, and then we'll hold off on the questions. It'd be better if we let everybody, speak first. Please do hold off on your questions, and then when everybody's finished, we can then take them forward. So, Zeus, is it possible for you to please play the first one?
Dear colleagues, it is my pleasure to be with you today. My name is Svetlana Negroustoueva, and I lead evaluation function and independent advisory and evaluation service of CGIAR. Unfortunately, I cannot be with you today in person, but my organizers kindly agreed to let me present virtually due to unforeseen circumstances. I will talk today about bridging borders, evaluating regional public goods for sustainable cooperation, and provide an example of our work on the process performance evaluation. So the takeaway of the session and of my particular presentation will be that science is crucial for sustainable development, and as it allows to bridge and scale up regional to the international public goods for sustainable development and towards sustainable development goals, SDGs. And as such, I will frame the CGIAR approaches and present some findings and key takeaways. For those of you who are not familiar with CGIAR, CGIAR is a global research partnership for a food secure future dedicated to transforming food, land, and water systems in climate crisis. And its work is implemented through 14 centers, international research centers that are based in different countries of the world. And the concepts that are key to CGIAR are research, science, and international public goods. So for definitions of research and science are presented on the left, and they are the definitions that are that guide work of CGIAR, and those are the definitions of CGIAR. And on the right, we can see the definition of the concept of the international public goods. CGIAR system conducts research to produce international public goods of wide applicability, creating a scientific base which speeds and broadens local adaptive development, which means that we're starting from the bottom up from the top down. CGIAR strategy is 2030, and its core pillars are impact areas and SDGs. And on the left I'm presenting some snapshot of the monitoring data, which can be broken down by SDGs and impact areas, which closely align. And you can see that there is a relatively moderately even spread of impact areas and SDG results for Asia, this is in particular for Asia, especially for gender equality and for zero hunger and no poverty. So these are the core important pillars of our work towards sustainable development. For Asia in particular, of interest to most of you in the audience, in CGIAR research centers, there are 5 in Asia, and my colleague Cristiano will be representing one of them, and Moogdho will be representing another. And WorldFish is in Malaysia. In Philippines, you probably have heard about International Rice Research Institute, ICRISAT in India, IMI in Sri Lanka, and Center for International Forest Research in Indonesia, which is partially part of CGIAR system. And of course, then on the other side of the map, you see that there are centers in Latin America and Africa. For evaluating in CGIAR, there's also very important concepts that relate to the fact that we are a research for development organization, where the ex ante reviews are as important ex post. So the evaluations that I lead are process performance evaluations and are guided by the work of evaluation policy and evaluation framework that do not touch the impact assessments or impact evaluations, as those are conducted as part of research activities. So now we move into the presentation of results for science group evaluations, and we hope that you will find them interesting. So science groups, science areas are the three pillars of the how the work is implemented under the 2030 strategy, and they are genetic innovations, resilient agri-food systems, and system transformation. And those are implemented through 32 initiatives, which can be roughly called as projects or kind of programs. And for science group evaluations that we started earlier this year, we're just wrapping up. The management response is being developed by the science groups themselves, so there are 3 evaluants. And methodology broader, I'm describing here, but also with some snapshot for Asia. So it's mixed methods. Very important is that we triangulate of expertise and evidence, and I will talk about it later in a second. And the theory of change analysis, as a research organization, theories of change are very important. Analysis of quality of science outputs, portfolio analysis, and assessment of recommendations from previous evaluations, the status of the implementation. The survey was conducted, which received 450 responses internally and externally, but 118 were based in Asia. And interviews altogether 113, and there were 11 case studies and deep dives, but 4 were specifically related to field work or analysis of Asia. And very important is the fact that for 2 initiatives out of 32 were Asia regional integrated initiatives, and field trips were conducted to Vietnam and Bangladesh in your region, and other regions included countries like Colombia, Ghana, Kenya, and Washington, D.C., where IFPRI is based. For in the context of public goods, international public goods, it is important to highlight the approach to evaluating quality of science and evaluating science groups. The international public goods in our particular context today apply to outputs. As much as we would consider design, inputs, and management process, outputs are key to what actually becomes taken up from the local to the national to the regional. And so I'll present some results to that. For the evaluation, the designated questions about quality of science are presented on the left, and they relate to processes that ensure the production of quality science through credibility and legitimacy, and also the quality of the actual outputs, which were assessed by our subject matter experts. And this brings me to the importance of this triangulation of expertise. While we know that in most contexts there are teams that work on evaluations, in our context, teams of evaluators are led by subject matter experts. And I'm just presenting a snapshot of those 3 teams. And if you read their bios, profiles, they represent wide range of topics that CGIAR grapples with. Importantly, they are not evaluators, so they bring their technical expertise, and they're renowned in their fields and have a record of publications and recognition globally. 3 criteria that we'll focus on today in this particular discussion are coherence, relevance, and quality of science, as they all relate to the production of international public goods, the process, and the results, and focus on the 4 case studies, with particular one on One Health approach, for which fieldwork was done in Vietnam. Again, for the quality of science, because it is a designated evaluation criterion in our evaluation policy, we'll drill into the concepts of design, input, process, outputs as concepts, but again, focus on the outputs. And this graph is very important, just understanding our approach and seeing how we operationalize quality of science criterion. Sometimes we use it individually as a designated criterion, like in this case for science groups, but sometimes we use other criteria, OECD criteria, and we just take dimensions of the quality of science. Such was the case, for example, in the gender platform evaluation that we conducted last year, where the focus was also on the analysis of outputs. So it brings us to the content of the discussion of the actual work. So the front and center of the portfolio are CGIAR. Of the 32 initiatives are 6 regional integrated initiatives, and by design they are producing regional public goods, and they coordinate and collaborate work in the regions. Of highlighting here are the Asian Megadeltas initiative, which is housed, I would say, in IFPRI in Philippines, and Transforming Agri-Food Systems in South Asia initiative, which is housed in Bangladesh. And for the emphasis, also you can read the emphasis, the research emphasis of each, and I will cover them a little bit later. But it is important to understand that for the relevance and coherence, it is the design was done, and such importance was brought into regions and countries as the points of entry. For relevance and coherence across different geographies as related to regionally integrated initiatives and others, they were designed to advance in scaling, readiness, and use. However, the potential for coherence envisioned between RRIs and the other types of initiatives, which are called global thematic initiatives, did not fully materialize in offering scaling opportunities and improved integration between the national and regional levels. Why? Limited capacity to engage with partners in different sectors, including private sector, not clear strategies, and unclear scopes of pooled funded and bilateral activities, such as, for example, USAID funded activities in countries which are supposed to match with CGIAR pooled funded activities that are funded out of the kind of main headquarters. And of course, as always, the structural and managerial challenges that are faced in an organization of that size and coverage. For relevance and alignment with national priorities, I am providing an example of Vietnam, where there was in a couple of years, they've been conducting listening sessions, and in other countries as well, which have been considered important for internal and especially external stakeholders to foster better corporate positioning of CGIAR, but also understanding what the country's needs and how to align it at the regional level. Such, for a particular example of one of the main activities is the work on addressing climatic challenges in the rice production of subsector in the Mekong River Delta, and this was in the report of the Resilience Agri-Food Systems Science Group. So I already mentioned Asian Megadeltas initiative. It was highly influential in shaping one of the programs for the high quality and low emissions rice with the Ministry of Agriculture and Rural Development, which brought in the commitment. And also related to that program was the other initiative, Excellence in Agronomy. economy, which contributed to developing mechanized seeding technology for rice production. For Bangladesh, I'll show some good examples here include the regional kind of public goods and collaborations, such as on one of the initiatives on climate change, climate resilience, approach to cultivating transdisciplinary partnerships with NGOs, boundary organizations, community groups, bridging research outputs and change in people's lives, not just at the national level. Also, the examples at the bottom are of the work in Bangladesh and India, Bangladesh and Myanmar, where outputs such as value stream maps were developed and shared and scaled, and in WorldFish, where Cristiano will cover later. For Vietnam, particularly case study on One Health initiatives, as I mentioned, Vietnam is a hotspot for zoonotic diseases, and the purpose of the program was to pilot a food safety rating system to address the critical issues of pork safety in traditional markets by the end of this year, by December 24. Also, there are good examples of randomized controlled trials that were conducted in Vietnam, and the learning has been taken up beyond Vietnam under these initiatives to Ethiopia, Kenya, Philippines. So the next slide just presents another kind of snapshot of the innovations and technology, the quality of science outputs, but also regional representation of opinions and perceptions of the quality of those outputs between Asia and Africa and LAC. And we can see that overall the quality is highly appreciated, and it actually seems to be more appreciated in Asia compared to, for example, Africa. The ends are relatively comparable there. So now we bring to the discussion of actually science groups, the three, and again, some examples. For one of them, Genetic Innovation Science Group, one of really kind of the global to the regional or national public goods is the Global Market Intelligence Platform, which strengthens decision making and enhances accessibility of product profiles for breeding product profiles, that is, through the Genetic Innovation Toolbox. And I did a snapshot of the platform on the left, and on the right in orange box is an example of guidance that one can find there, which is produced by the Rice Institute. But basically, this is an International Rice Institute in Philippines. So it's made available to breeders globally, and through that platform, and it was developed recently in the last couple of years under GI. For Agri-Food Systems Science Group, some of the technical outputs and work relate to the capacity, which is really important with working with the research for development context with scientists and researchers in the national agriculture research centers. Mechanized direct seeding for farming efficiency and reduced carbon footprint and rice production in Vietnam again comes up in that particular science group. And under the umbrella of CGI Excellence in Breeding Platform initiative that became under GI as well, is the development of the IT database for global map dashboard, again to facilitate the resilient agri-food systems globally and learning between regions. For this science group and others, analysis of publications was conducted, so we present for each information on quality of publications and their influence, and that can be found more in the reports that will be posted soon online. For the last system group is the system transformation, which covered nutrition, climate change, gender, and other areas which are systemic. And some findings here relate to production of early warning systems for drought using monitoring and forecasting systems and drought indices to effectively track climate change impacts directly, addressing the challenges identified by the IPCC. And a low emissions food systems initiative integrated GHG emissions calculations into carbon credit applications. So those are examples of outputs, quality of science outputs of the science groups. So that brings us to the conclusion. So the key lessons learned from the evaluations themselves, but also types of recommendations and for the session. Very important lessons learned were on lack of guidelines on intellectual property rights across the different science groups. And if there are such guidelines in different CGIAR centers, they vary and they applied in different ways. And unfortunately or fortunately, there was limited evidence of partnership agreements such as MOUs, which would have cited such clauses. And as we can understand, those are very important for the production of the quality of science outputs, the public goods, who owns, who has rights, and who takes the benefit. In Bangladesh in particular, and it was echoed in some other countries, was the need to work closer with NARS, with the agricultural research systems. And the main factors behind the maybe limited quality of outputs that CGIAR and centers and initiatives have produced under science group evaluations were the pressures to deliver, funding uncertainty on the annual budgets, and more reform fatigue. CGIAR has gone through quite a few reforms in the last dozen years. For these are the type of recommended activities that are produced by science group evaluations, of which there are many more. And this is a snapshot of, for example, streamlining scaling of successful innovations. So learning how to streamline and scale up, and how to take local, national to regional and international, which is very important for this discussion. To address issues of research ethics, what already talked about, intellectual property rights, and developing positioning papers on different topics. For example, in this one is interface between fundamental knowledge creation and uptake and scaling, and a consistent and coordinated approach across science programs. So scaling, targeted strategic scaling, requires budgeting. And for the takeaways for this presentation is that science is foundational to a production of international public goods and to solutions towards achieving SDGs. However, it requires resources, coordination, collaboration on the research for development continuum requires resources, and in our context of evaluation conference, it requires nuanced methodological approaches to enable identification and application of results of research for development work, and CGIAR offers this. And I'm providing my contact information if anybody wants to reach with questions. Thank you very much.
Great, that was good. All of this will be available in the AEW website anyway, so if you do need the material, please do access it. It's unfortunate that Svetlana cannot be here because there would, I would imagine, be several questions that we could pose to her about the nature of the work and some of the recommendations that she has made with respect to what the consortium could do. We'll pick up the individual pieces from that. In the slides you mentioned, you could see that she'd mentioned the work of WorldFish. We have with us Cristiano here, who will then take you through the issue of impact assessments in the area of aquaculture, and with a case study of Bangladesh as well. So, Chris, over to you.
Thank you so much. Can you hear me? Yes, all right. Okay, so thank you very much. I mean, it's great to be here. I think it's a great opportunity to share our experience with others, and it's a very good time for reflect on what we are doing, and it's very good for me also to think about what we are doing and be critical on our work. So thanks for the opportunity. Thanks for the organization to having me. So I'm going to talk about WorldFish experience with impact assessment, but more in general around public goods. So in a nutshell, when we think about impact assessment in my organization, I think it's something we can share very much with others. It's basically we are looking to measure the change that we are supposed to achieve, right? Through a specific intervention that in our case is related to aquatic food systems, in particular in aquaculture and fisheries. I'm going to speak about aquaculture today. But it's not just measure the change, it's also ensuring that is is just our contribution. So to make a distinction, from other factors that may affect or influence our impact or our intervention. However, you know, since I arrived in WorldFish in 6 years ago, so 2018, I started looking at you know, how we are implementing impact assessment, and I see a lot of challenges and limitations in the way we are doing it. You know, the cost is a big issue, and there is a tension between implementation, so using money for implementing things and using money for, you know, assessing what we are doing. So building accountability is important, but at the same time, there is tension there. Time, you know, impact assessment requires a lot of time. There is a strong disalignment between, you know, when the results is ready and available and thoughtful, and the implementation cycle. You know, we are always running behind a new project, a new intervention, a new something to deliver deliver new things, and you know, we are struggling to provide the right response to people that they need to act, to reflect and act and adapt. But also there is a problem about learning and adaptation. I have seen this in various presentations. And in which sense? You know, we have a very preset mind on what we want to see. And we are very much looking at specific dimensions that we believe are true at the very beginning of the intervention. But very much these things are going to change. And having this fixed mind is preventing us to look at unanticipated effects or unintended consequences. So, you know, being flexible in impact assessment, it seems like a paradox, but it's very important. And finally, the last point is the context sensitivity. You know, I'm doing impact assessment in more than 12 countries at the moment, and honestly, there is a huge difference and based on the context we are operating. Sometimes we tend to generalize results and learning out of the specific context, but the generalization sometimes could be harmful. I mean, we have to be particularly thoughtful about it. Now, my public good. In WorldFish, we have many, not, I would say, as many as we would like, because I think we should be serious when we speak about public good. It's not just publishing a paper or coming out with a new idea, but it's something that's really valuable to change the life of people, you know, and has the value to become a public good, really. So this one, sorry, I know this is a little bit off topic, but it's important to understand the rest of the story. So this fish that you see there is a tilapia, right? This fish basically became very famous. It was already, of course, but WorldFish was the first center to develop a genetic program on tilapia. And basically what we did in 1988, with partners, of course, was to establish the first genetic program and develop a fish that is improved. So it's growing faster, is able to produce high yield, is adaptable and resilient, so is, you know, in the climate change environment, is able to resist to a lot of threats, including low oxygen level due to the higher temperature in the environment, and it's also disease resistance. So, you know, it's a very super machine that is not just working well in a super farm, but the good point is working well in a smallholder condition, okay? However, there is not just this. The genetic program itself was taken over by basically private companies worldwide, and we assess the genetic derivation of the fish in the current improved tilapia worldwide, and all of them are gift-derived. Sorry, I'm saying gift because the name of the improved fish is genetically improved farm tilapia, which we like to call gift because it sounds good and it's easy to, you know, to sell it out. So, the impact, you know, this fish, of course, the pathway is increased production, increased productivity, more self-consumption, food security, more income, poverty reduction, and also reduction in CO2 emission, GHG emission, in relation to the fact that it's consuming less input per kilogram produced. I finished the technical part, so now I go back to something that is more interesting for everybody. this is basically, and thanks Svetlana, because she helped me a lot to now explain what I'm going to tell you, my main problem in evaluating a public good. So what's the step? What are the steps there? So the first step is research. You know, we start from research. We develop the fish. It's growing faster. Yeah, thanks God, right? We are good to do this. But after that, we have to deliver the fish to somebody because, you know, it's not just having a fish that grows faster. You know, somebody has to use it. And we have the first step that is basically specific studies where we are able to keep relatively under control the situation with a limited number of farmers. They are basically where we are testing the effect of the fish in farming condition, and also effect on the livelihood of people in terms of food security, poverty reduction, and such. However, after that, you know, we have a system of dissemination. We hand over the fish to private sector, sometimes to government, for free, of course, through agreement. Private sector is a responsible private sector, of course. We have tight check on it, and memorandum of understanding that are clarifying these aspects. But, you know, we exactly try to follow the mechanism of how this is going to be scaled to a larger number of farmers. But when we reach the point of measuring the impact on the region, on an entire country, we struggle very much because we don't know exactly where the fish has been transported, how there are many uncertainty there. So I'm speaking about measuring the impacts, but also the related uncertainty that we are, you know, based on the measurement. I'm an academic originally, so for me this part is very tricky because I can keep like a relative robustness of the methodology here, but here I struggle. What has happened since the last time we deliver gift in the environment? We spend a lot of time to do it, and it's basically the dissemination. The color indicates, darker color indicates where more fish is available. The lighter color is basically white is no fish, no gift. And you can see that in 2020, gift is basically everywhere. When I'm saying gift, there are many gifts because we release the fish many times in the environment. So every year we improve and we release a new generation, okay? But the bigger release was done, the most important release was done in 2012. So we tried to track this one. And we reached the point where basically, yeah, fine, we have a nice map, we understand where the fish is, but I'm unable to tell what exactly has happened, what the result, what's the contribution for the country, right? It's a very important public good. You know, government of Bangladesh come to me and say, Cristiano, can you please tell me what's the contribution? Because we really like this, we want to invest it. But, you know, there is no evidence to do it. I can tell them that many people like it, they are using it. I can tell them that the result in the FAR, but I don't know what's the contribution on the food basket of the country. I don't know what's the relative reduction in poverty there. It's complicated to say. So this, however, this failure offered me the opportunity to think out of the box. And I'm start thinking, what I'm missing to tell them the answer? What's important here? I miss exactly a benchmark. I don't know, I don't have the longitudinal data to tell a story. So we start looking at systematic categorization of basically aquaculture systems and looking at profiling basically the aquaculture practices. So we try to profile in terms of impacts. And we usually basically key dimension, and we do a sort of longitudinal study. We start to do it in 2021 after this case, okay? So we are collecting routine data, basically, on a very large sample of farms, where we are able to tell, after the collection of the data, how the farm is performing in terms of sustainability outcomes, okay? So the methodology is here, without going into much in details. Everything that I say is published, so, and it's open access, because as public good, right? Anyway, what we discovered through this experience of categorization, we discovered that basically one of the reasons why we are unable to tell the story is because there are a lot of different degrees of gray there. So In the reality, there is not an average effect, but there is an effect that is different based on the cluster of production system. And we identify 4 main clusters that we conventionally like to call farms that are they have a highly commercialization focus, farms that have a moderate commercialization focus, farms that have a low commercialization focus, and farms that have very low commercialization focus. The difference between them is basically the input level. So here they use more input, here less, the labor. And I mean, there are many, many factors without going too much in the technicality here. The most important thing to highlight is that we need context information to tell the answer. And this cluster analysis is basically telling us that there are a lot of parameters we have to keep in account to tell this answer. Oops, sorry. Yeah. But we don't just cluster the thing. We start looking, again, sorry, it's looking good, but not easy to read. We look also at the performance in terms of outcome impact. So the first couple of things, here you see the different clusters. So this is the cluster the cluster with the high commercialization. This is the lower commercialization one, right? And here you see the indicator that we take care of, we look for. So we see that the one with higher commercialization, they are better to sell fish, but they are polluting more the environment. And they are also, yes, helping to resolve the problem of poverty because they are selling the fish to urban ports, but they are not good for self-consumption, etc. So we categorize also the outcomes. The important thing of the story is, and this we start to understand something much more interesting, that is this information is not just useful for us for the impact assessment, but it's also a byproduct because it's indicating how we can shape policy and investments much more specifically on the context that we are looking for. So, if for instance a policy is considering to target a certain kind of aquaculture system, will achieve an effect. If it's going to target another cluster that is probably the smallholders one, the yellow one, is going to achieve another effect. So this is pretty interesting. At the end of the journey, I'm just present a case in Bangladesh, but what we have done and what we discover is that we can implement much better our impact assessment to evaluate our public goods if we work much better with partners and we look at establishing alliances in the context, so in the specific country, in this case in Bangladesh, because in this way we learn much better on what's going on and we can understand exactly the nuances that we need to understand to provide the right answer. We produce a lot of new knowledge about it, so this idea of characterizing the food system through longitudinal studies is extremely valuable, not just for the impact assessment, but it's producing new knowledge. We have implemented this already in 7 countries. We have produced 25 data sets that are open access and available. We have published 9 reports and 11 articles. And we are working on something that is a sort of aquatic food system sustainability index. So we want to make all this information in something that is simple to understand, an index. That doesn't mean that we are losing again the track of the qualitative information, because it's still relevant. We need to work with others to understand, to read our results. We also have develop a methodology and make it available to others. There are a lot of digital tools that are serving the purpose of collecting data that are available and open access. Again, we generate public goods for scaling public goods. And, basically, we provide recommendation information to stakeholders and policy and decision makers, right? Because basically, the information that we got is like, hey, if we are going to deliver the next generation of tilapia in Bangladesh, if we target this specific group of farmers, this is what we expect to happen. So I can be much more focused on what I'm looking for in my impact assessment. It's going to be much more effective and much more robust. Finally, and this is my last slide, I hope I am on time, right? So what we also challenge about is that, we create a lot of data, information, knowledge, but it's difficult to be used because it's very complicated. You know, when I'm sure when I show you the graph there, everybody say, "Oh, this is looking like too complicated." Exactly. I mean, sometimes the knowledge that we produce are really there is a gap, right? It's difficult for people to use it. I mean, it's being able to communicate about it is crucial. So we are working also with, I think I heard before, artificial intelligence and such. So we work also to create sort of portal to share these experiences. And this is basically each study, each data set that we produce is summarized in a very simple way in key messages and serves very much on, you know, on trying to transform the aquatic food system also through data and digital innovations. So that's it. Thank you so much.
Thank you, Chris. There's a few things there that you've raised, which let's get when we'll have Moogdho will then be able to comment on a few things that have been mentioned with respect to Bangladesh. Let me pass it on to Moogdho then now, please. You'll have 15 minutes to finish it. Thank you.
Thank you again, and thanks to the organizer for inviting me and letting me give you some evidence from IFPRI that we are working on. So first, I'd like to thank my colleagues, Dr. Akhtar Ahmed and Dr. Mehrab, who are working on this particular thing called Bangladesh Integrated Household Survey. And they have been pioneer of it, and I joined the team recently, and I'm very happy to share our work on this particular thing and how it could be considered as a very important global public good in research. I'll try to keep it short so that we can have some time at the end to get some questions and discuss the materials that we are covering. So, three aspects of my talk. As I have said, I will talk mostly about Bangladesh Integrated Household Survey, its implication, the methodologies, and why we consider it as a global public good in research. And then I will have a couple of comments on Chris's presentation and finding some common ground maybe where IFPRI and WorldFish can join hands and do some serious research together. And then I'll end at the end talking about few randomized controlled trials that have been done in Bangladesh out of thousands in the past decade, and why it is important for impact assessment. With that, let me dive into talking about BIHS, Bangladesh Integrated Household Survey. It's an integrated panel data, and as you know, that many of the survey at the national level in developing countries which are conducted, they are cross-sectional. So we found that it is very important to have some kind of survey that have panel information so that you can actually assess the development that is going on within households for different kinds of programs. So we started this, we have completed the third rounds, and we are planning to do the fourth round from this year. It also has plot level data at the agricultural production and practices. Before that, it was mostly household and farm level data. So we have information on plot level which have been used highly to formulate many important policies. We also have information on dietary intake of individual household members and also anthropometric measurement of all household members. Initially, if you compared with DHS and other household income expenditure survey, you will see that mostly they're taking information at the household level only. But now that we have individual level information, you can do a lot more than the usual surveys. Finally, another important feature of BIHS, that is we collected data to calculate women's empowerment in agricultural index. This has become massively popular. It was started from Bangladesh, and now CGIAR initiatives and IFPRI and are trying to invest and trying to invent this for other countries as well. So we could have a global women's empowerment agriculture index comparing all the developing countries. Again, as I've said, mostly so this household level survey that we are doing, it's nationally representative. It's also divisional representative of Bangladesh, and given the importance of this work, especially as you know, we are focusing on nutrition, agriculture, gender, and overall socioeconomic indicators within this survey. It has become very popular, and especially recently, the World Bank has provided $500 million to Bangladesh using the BHS data, providing the poverty maps, and then deciding where to invest in Bangladesh. So it has become very useful in the context of Bangladesh and could be replicated in other countries as well. Just quickly on the methodology that I have said already, I think. So it's a panel data, and you know, we can talk about the pros and cons of panel data versus cross-sectional data. But it has opened up many avenues using this panel to do research on many important things which has direct bearing on policies. Again, BHS is a nationally rural representative survey, and it represents all the administrative divisions in Bangladesh. We have conducted 3 rounds, 2011, 15, and 18, and hopefully from this November, I will co-lead the BHS 4th round of survey. So around 5,500 households are rigorously surveyed for this BHS for every round, and we have done 2-stage cluster random sampling. So if there is any chance of bias in terms of selection, we try to minimize it with our selection criteria. And also it is represented at the village level, and we have the GIS information. So due to having this GIS information, many of the geospatial analysis that have been done were using BHS data. Again, so we try to maintain like high accuracy in terms of collecting data, and there were pre-tests done, there were training done. There is a very rigorous data institute that is working with us to get the data, but we make sure that there is always a check from the researchers that the data which is coming, which is reliable and minimum of errors. This is basically the process that we do. So from the field level, we try to make sure that the data is coming to us immediately so that we know what is going on. And then it is given to the data entry system. And finally, like when it is there, our IFPRI office, all the researchers, we work on it to make sure that this data is ready to use. There are many examples. Just to give you one example that I thought would be interesting. As you know, globally, we use demographic and health survey, DHS, for the major socioeconomic and health-related analysis. So over here, just one example where you could show that the first column is coming from BDHS, Bangladesh Demographic Health Survey, and then it's BHS for 2011 versus 2017. And 2018. So there is clearly something going on, especially if you see for prevalence of wasting for children. So the numbers are different, especially for wasting, and it's statistically different. So, and the way BIHS collected the data, we found that it's more. So again, taking a policy based on numbers, it is very important to know which survey we are using and why it is important to use the relatively correct one. So there is some discrepancy when you compare this with other surveys that's going on in many developing countries. Yeah, and lastly, like, you know, why we think this has become a global public good, though I know publication is not directly global public good in a sense that the way it is, you know, changing people's lives, but there are many policies, many papers have been created using this data that we believe are having major impact. So this is outdated data till 2021. So there are many downloads of the data, and so far what I heard, 160 publications in good journals have been done. And it's not only by CGIAR or IFPRI researchers from around the world are using it. And now that, like, you know about BIHS and its impact, and we are going to start the 4th round, I welcome your comments, and please let me know if you have any specific things that you would like to see in the survey, and we would like to incorporate that to help the global research community. Yeah, so these are the links where you can see, you can go and find. We have made it free, of course, so the data is available for you to use. These are few examples of the papers that have been published and have high importance in terms of policy using BIHS data set. All right, so from BIHS, from IFPRI's IFPRI Bangladesh flagship work, I would like to have my thoughts, my 2 cents on Chris' presentation, and not particularly on the presentation of their methodologies or the challenges to do impact assessment on the context that WorldFish is working. But I thought this would be interesting. So this is the ongoing work IFPRI Bangladesh we are doing. So if you see, that's the Bangladesh map. And we have developed an index for 64 districts in Bangladesh, so where we have used different number of variables to understand the food availability at the district level. And one of them is fish consumption as well. But this is showing relatively the darker ones are where food availability is less, and the more blue one where there is more food availability. So what I was thinking, because the work of WorldFish that Chris presented, we have information about fish production. So if eventually we can match this where there is more need for food and fish, let's say, and then it would be very important for the policymaker to understand, okay, these are the areas where we should maybe focus on providing more fish. So one thing is about the production area. Second thing is about the need for food. So if there is a mechanism that could be developed with WorldFish and IFPRI, where we could actually recommend policies where, okay, this is the area where there is much more need for fish consumption. I thought it would be very interesting if we could use, both research and data to come up with policies. So that was my main point, and then. Yeah, I believe that it is in general, like you see, I think next presenter will talk about it, but randomized control trial, it's not easy to do everywhere. For example, we could think about why didn't WorldFish did some RCTs on understanding the importance of production of tilapia, but it's not possible for many reasons, and especially given how they wanted to represent it for the whole country. So it is not always easy, but yes, given that shortcomings, I think is still there is good options, to show that if this kind of production and consumption mechanism are done together, there should be some important contribution to policy as well. All right, lastly, I'd just like to talk about randomized control trials. Bangladesh especially has become very popular for RCTs. There are many work going on. Many of the scholars, Western scholars from good schools, and many of the international researchers from international organizations are working on RCTs.
Sorry, 5 minutes, okay?
5 minutes, thank you. Yeah, I'll be done by 5 minutes. And so just few examples why it is important. Sometimes RCT could also have a broader overarching view in terms of understanding impact of many kind of programs. So first one, it was transfer modality research. It is done by IFPRI. I'm not part of it, but I found it very interesting where they have shown, designing interventions where cash transfer with complementary nutrition behavior actually reduce poverty and also reduce intimate partner violence. And this was very popular, and building on this research, many of the other developing countries trying to understand how they can actually devise policies where there could be a direct impact on poverty reduction and a reduction of IPV, intimate partner violence. This is a work on beacons that I'm a part of, and where we just changed the method. It's a very low-cost method of making bricks, where we have found the environmental pollution in terms of CO2 and PM2.5 have decreased substantially. And due to the success of this RCT, we are scaling it up for the whole country, and then there is a very good chance that we will do it for India, Nepal, and other countries where they have similar production method of brick production. So this is one example where scale up and external validity has become very important. Lastly, I would like to talk about this Musk study. If you remember, it involved hundreds of thousands of people in Bangladesh. The question was, remember during COVID, whether Musk is actually helping people to get less COVID or not. less infected or not, but it was not done properly. So this was the first rigorous RCT, which involved millions, like literally millions of people, thousands of villages, where it was shown that actually masks work in terms of reducing COVID high risk. So these are some examples, and I'm pretty sure you have many questions on RCT. I'm looking forward to Tara's presentation, where she will talk more about how RCTs and how generalizable they are. I think that's it, and I welcome you to share your thoughts on BIHS and other things. Please do write to me and talk to me. I look forward to it. Thank you.
Great, thank you. Thank you, Moogdho. Finally, Tara, over to you, and again, the focus being on the issue of generalizability, because of all the things that we've heard, the question then is, if it works over here in this small space, how widely generalizable can it be? So, over to you.
Hello. Great. So thank you so much, fellow panelists, and thank you for being here today. I know it's the third day of the conference, last session of the day, last presentation of that session. So thank you for your attention for a few more minutes. My name is Tara Marwah. I'm a senior policy manager at Innovations for Poverty Action, IPA, in the Philippines. And I'll be talking about the generalizability puzzle and how to work around that. That's something that Cristiano also mentioned, that there's a sensitivity around how to generalize things, and thankfully we rely on smart economists to find solutions to these kinds of problems, and I'll be presenting one of those. But before I do, may I just ask, who here knows about IPA, Innovations for Poverty Action? Just raise your hand if you have heard. Okay, and have you heard of JPAL by chance? Also raise your hand. Okay, a few more. Right, so IPA and JPAL are actually sister organizations, so a few people know that. The co-founder of JPAL, Esther Duflo, leads JPAL, obviously, and her sister Annie Duflo leads IPA. So as sisters do, I have taken the liberty of going ahead and borrowing some of their slides to make this presentation. So thank you so much, JPAL, for that. Okay. Esther Duflo, like I mentioned, co-founder of JPAL, has loads of experience in decades in research in alleviating poverty. And what she's found is that we keep running into the same problem from place to place. The solutions, in a sense, can be the same. You learn something general, and from this general finding, you can extract a lesson that policymakers will then tailor to each individual context. So that's essentially summarizing the presentation that I'm about to give you, right? I'll quickly introduce IPA and what are randomized control trials. We've been hearing about them for the last few days. And then I'll introduce this thing called the generalizability framework and walk you through how to actually apply that in your context. Okay, so at IPA, we discover and advance what works to improve the lives of people living in poverty. So IPA is an international nonprofit founded over 20 years ago. We do that in three ways. On the very left, you see create evidence. So create evidence for us is usually through RCTs, randomized control trials, but we also work with quasi-experimental designs and other approaches. But over the last 20 years, IPA realized that you can't just produce evidence and then hope that everything changes. So that's why we spend a lot more effort on sharing that evidence strategically and also building the capacity for policymakers to actually use that evidence. So that's what we do in a nutshell. Okay. Now to the randomized control trial. I'm thinking a lot of you already know what this is, but here's a refresher maybe for some of you. How this design works sometimes can be a little bit scary, but it's actually the simplest way to evaluate a program, in my opinion. So you have a sample, and then you randomly divide that sample into two groups, a treatment group and a control group, left alone. And then at the end, you compare the outcomes. So this is a very, very simple design. The key here is that the two groups are not differing systematically. So one group and the other group, they were not divided based on northerners and southerners or age or education level. They're really statistically the same. They were randomly divided up. And the other kind of condition that we need is that these two groups are large enough. So what we heard on day one, a sample size of 1 and 1 is not going to fly, right? So you want to have large enough groups. A more complex RCT also exists, right? So you can also have various treatment arms. You can have more groups, each receiving a different program arm, and we can even measure the impact of each program arm and even how these different arms interact with each other, right? So you can, in the immunization example I just gave, you could have one incentive being lentils, another incentive being rice, et cetera, et cetera. So you can work with different treatment arms. But the more program arms, the bigger the sample that we need and the more complex the program, particularly regional programs, that's how they're going to differ and how they implement from country to country. And essentially, it's not really ideal to do an RCT for that kind of regional public good in that sense. So the question is, how can we generalize these results from the RCTs that we're seeing of one specific program to another context? And that's the generalizability puzzle that policymakers have been facing for a long time. So here's an IPA slide. We have 19 country offices. We have almost 1,000 evaluations. Maybe yesterday, if you went to the development impact session, 3IE also mentioned they have their own database. JPAL also has a database. What I'm saying is there's a lot of RCTs out there for policymakers to use and inform their programs. But the main question is, how can we leverage the existing evidence base to ensure that we don't reinvent the wheel every time we run into a similar policy issue? Okay. Enter the generalizability framework. So often, so I'm a policy manager, right? So I proudly live and work in the Philippines, and I have to work a lot with, or I get to work a lot with government there. And a lot of the times when we're reviewing evidence, we get these questions: can a study inform a policy only in the location that it was undertaken? Similarly, should we only use the evidence from our location? Or what counts as a similar enough new setting or location? Must a program be replicated several times before you can scale it up? Now, thankfully, the answer to most of these questions is no. You're very rarely going to find an evaluation that exactly fits what you're trying to implement and the program that you're trying to run. So this is what I'm advocating for, that we shift these questions from are the locations similar to is the problem and its underlying cause similar. Stop thinking about how many times has it been evaluated and more why did the program work? What is the strength of the evidence? And in particular, what's the general behavioral change that you're seeing that may be applicable in your context? The generalizability framework, in the sense that I'm presenting, was kind of invented by Rachel Glanister and Marian Bates. And this is how it looks like. First, you look, it's 4 steps. So first you look at what are the needs, what needs does the program address, and what is the disaggregated theory behind that program. I think everybody here knows how to use the theory of change, and that's essentially the first step, is what is really this program all about. Second, what are the local conditions? Are the local needs similar? Do the local conditions hold for that theory of change to apply? And third, how strong is the evidence for the required general behavioral change? And this will be very key when you're comparing different evidence bases and trying to, see how it fares in your context. And finally, local implementation. So what is the evidence that the implementation process can be carried out well? With these 4 steps in mind, we're going to walk through an example. Okay, so I know a lot of you are evaluators, and hopefully you deal with policymakers. Imagine for a moment you're a policymaker. So imagine you want to improve health outcomes in your country. Again, I proudly live and work in the Philippines, so I'm going to keep Philippines in mind. Please keep your country in mind. Your needs assessment shows that only a small percentage of the population has completed a full immunization schedule for a life-saving vaccine. Okay, you want to design an intervention to increase these immunization rates. I think a good first step is to go to the IPA website and type in health and immunization and see what kind of evidence there is. And I just did that, and I see, okay, first study there is improving immunization rates in rural India. And I see, oh wow, this is Abhijit Banerjee, Esther Duflo, and Rachel Glanister. These are great economists. What did they find? Okay, so this program was implemented by a local NGO, and it was designed to increase immunization rates in rural Rajasthan, tested with an RCT. So the way they designed this is to tackle the demand side and the supply side. On the supply side, they implemented regular monthly immunization camps in various villages that always had a nurse present without fail. So that nurse also had to take a picture of themselves with a timestamp. So these immunization camps were implemented. And on the incentive side, the demand side, they provided 1 kilogram of lentils for every vaccination. There's 5 vaccinations for a full schedule. and a set of plates once you've completed the entire schedule. So that was the intervention. Okay. What they found through the RCT, let's start with the yellow bar. That's the comparison group, the control group. They didn't get any of these camps or incentives. And the percent at the end, so who actually was fully immunized, is 6%. This is very low. They also found that those that received an immunization camp, access to this immunization camp, that tripled the full vaccination schedule to 18%. But combining camps and incentives had a very great result of 39%. Okay, does this apply to my context? So I see there's an incentive immunization program. I see that the completed immunization rates rose. What happened in the middle? For me, it's a black box, right? I see there's only one RCT on this. It's in India. This is very different to the Philippines, very different demographics, right? The program was conducted by an NGO, whereas I'm trying to work with the government. And lentils are not a huge part of the local diet in the Philippines. Okay, so how can we determine if this intervention is likely to work in our context? There's 4 steps, remember? The first step, and I'm not going to walk through this, is a theory of change. Everybody knows how to do this. The most important part of this theory of change, when you're looking at the evidence that you've just identified, is the needs assessment. So here, what was the theory of change? The needs assessment was deaths from vaccine-preventable diseases due to low childhood immunization rates. I can't begin to tell you how many times, I mean, people think that theory of change is kind of an obvious one, but it's really not. Sometimes we ask policymakers in the program that they want to design to develop a theory of change, and if we separate the team members and then compare how do these theory of changes look like, they're completely different. So it's really important to kind of get on one storyline and understand what is your theory of change. Okay, everybody knows the rest: inputs, outputs, intermediate outcomes, and final outcomes. So this is how it goes from the needs assessment, the inputs, down to the impacts. The full immunization rates are increased. That's a theory of change, crucial step. The second is to understand the local conditions, right? So here in this graph, what do we see? What do results tell us about the local conditions? Is there access to the clinics? Is there access to information? Are the vaccines available? And we're looking at this study and trying to make these decisions on local conditions. What we see is that parents actually do want to have their children get vaccinated. We see that there's a 50% rate of getting the first vaccination, and then it decreases down, looking at the yellow bar, down to 6% as time goes on. So it seems to be an incentive issue. Parents can access the clinic. They obviously know where it is. It's accessible. We see that in the immunization camps. And full immunization schedule is salient. So we see this from the results of the study that we're looking at. The third step is the generalized lessons. So what do we know about the general behavior that we're investigating in that first study? We know this from other studies, is my point, right? So this general behavior that we've learned in the literature. We know that people find it hard to stick with behavior they believe is good for them and their children. I invite you to think about your New Year's resolution of last year and how you're doing on that right now, right? So it's classic, people just kind of lose incentives or lose motivation. We also know there's a high sensitivity to the prices of preventative products. We know this from over 15 randomized control trials, that people have a hard time and very price sensitive in paying for things that are preventable healthcare. Okay. And finally, local implementation. So the question here is, who will be implementing the intervention? This might be very different if it's an NGO compared to the government implementing it. So what we know is that incentives are delivered to the clinics, and we also want to make sure that the incentives are delivered to the parents. And how you implement that locally is TBD. So with that framework, summing up, we went from having a black box, not understanding where do these results come from, to a full-fledged generalizability framework where you're dividing up that evidence into bite-sized pieces, and you can pick, okay, these are actually useful for my context, these will potentially generalize, and these might not. And that is the generalizability framework. Here are some principles to keep in mind. Instead of focusing on place and time, focus on the needs and behavior. So what are the mechanisms that made the program effective in addressing those needs and shifting that behavior? Evidence from a single study is just one part of the puzzle. We weigh the evidence based on the quality and just prior expectations. And finally, combining theory, descriptive evidence, and results of rigorous impact evaluations to help answer questions like whether the results from one context are likely to replicate to another, and when we need more evaluation and when we really do not. Thank you so much.
Thank you, Tara. I actually like the principles that you had about the generalizability, because it's something that we struggle with when we say this seems to have worked in India, for example. Why don't we just take it over? But the very simple thing, for example, of it being done by an NGO in one setting, and in another one you're actually getting a government department to do it. So these are, fundamental issues. I'll open the floor for questions, and while you're thinking about that, I would like the panel members to sort of think about one question is that I have sort of thought about with respect to your presentation. Chris, on context specificity, you had mentioned that as one of the challenges in the work that you're doing. Moogdho, it'd be interesting to talk about some of the difficulties that you had with the BIHS, and I know you built it as a global public, as a public good that could be used and that has been used elsewhere. And Tara, with respect to the generalizability framework, you cited the importance of the theory of change. Any issues there around whether or not, if there's a weak theory of change, does that necessarily tear us under everything that we've talked about, or are there ways to deal with it? So while you're thinking of questions, let me just pass it on to you, Chris, to talk about the context part, because that was something that was mentioned by Tim on day one as well, about the context. So over to you.
Thank you, Gambhir. I mean, it's really, for us, it's really important to have this, to understand better this context specificity. I think particularly when, in the CGIAR and WorldFish, we work to a very long pattern that is doing research, to develop new ideas, technology that has to be scaled, adopted by somebody at that scale, and, reach many to produce an impact. So it's not like a simple pattern. And the issue of scaling is very much related to context and understanding the context and dealing with people in the context. For instance, we have also cases where, a certain technology that we were believing working pretty well in a context, in other contexts, could be even harmful. And so I mentioned also being open to look unintended consequences or unexpected. I think the two things are also related. Having this mindset, this flexible mindset where we are looking at things and learning, talking with people. I think focus group discussion and RCTs are, in these cases, working very, very well together. I like that Tara, when she mentioned that she starts from a theory of change, because it's very much about understanding the system.
Yeah. The assumption being that a theory of change does not necessarily mean the same thing in one setting versus another, because you're starting off with a different premise. BIHS, the issue of the difficulties there as a public good.
Thank you, Gambhir. That's really an important question. In terms of the challenge in general that we face in surveys in developing countries, it's income module. As you know, people, especially people in the rural area, they are very defensive about revealing their income. So normally what we do, we try to use the consumption module as a proxy. So that's in general problem that we also face in BIHS. Another thing that we are facing, the big question right now, because this is going to be the 4th round of panel, and as you know, for the longitudinal data, when it's get older, there are many things that you cannot answer with the data. So one thing that we're thinking to do a parallel cross-sectional survey as well to answer a few of the questions. And lastly, this overarching question of survey data versus your own data that you can generate from RCT. I feel like they're complementary. You can do many natural experiments, using survey data. And of course, if you have specific questions like Tara presented and I showed some example, RCT could give you a lot of, more precise answer. Thank you.
Okay, great, thank you. Yeah, I would imagine it would be a bit hard in countries that have, where in rural areas, as you go around and you try to get the information, it's not as easy as in other jurisdictions. Tara, theory of change. I've heard a lot about this. Tell me a little bit about the importance, the centrality of that with respect to the generalizability principle.
Yes, absolutely. So as I mentioned, the theory of change is really the blueprint of a program. So the theory of change will outline what is your needs assessment, what is the problem that you're trying to solve, and really outlines every step of the way that you're going to solve this problem. It also tells you about the assumptions that you're making from every single step. So for example, if I say one of my inputs is going to be providing lentils, it's not automatic that I know the output is that the lentils are actually being picked up. There could be a whole range of issues between providing lentils and actually having somebody picking them up. These could be process issues. So it really outlines the design of the program, the assumptions that you're making, and the risks that you're making. And so you really need to understand, how is this program, how does it operate? The evaluation that I'm looking at of this program, how was it operating, and how do I want my program to operate? I want to compare those two and see which elements of that program are going to be generalizable to my context. And if that first theory of change is weak, I'm essentially back to my black box. I really don't know what's happening, and I'm not really sure how these results are going to generalize to my setting.
Great, thank you. So going back to, again, the centrality of making sure that the theory of change is done properly and all that. I know we're running out of time, but is there anybody there that has any questions to ask of the panel right here? Otherwise, we can also, email it. Yes, please go ahead. Yeah, sorry, you might have to go there.
Thank you so much for the panelists, and also thank you for the audience to be the company for this afternoon. And we all noticed, right, and attendance very poor. My name is Hua Xu, and from New Development Bank, and I'm a senior procurement specialist. So my question is to Chris. You mentioned kind of your program is for the evaluation is really hard, since it maybe takes much longer, a long-term process. So may I know how you kind of build your, how to say, this characteristic into your evaluation methodologies from the very beginning when you plan the program? Thank you so much.
You're welcome. I think I start from theory of change. Yeah, and we really try to understand how plausible is our plan. How plausible is our plan for reaching the impact. And this also include, looking exactly as Tara was mentioning at assumption and risks. And if the plan is plausible, then we understand that it's worth to invest also on the program itself, but also on evaluating it. Because the other issue is that not everything is ready to be evaluated, and sometimes we have to accept the fact that we are not able to do it. This specific case, the tilapia, is my pain in the neck, because this is not something I can tell to my management, to my director general. I'm not going to evaluate it because it's not possible. I have to find a solution. So this is a pain. But in other cases, thanks to this lesson, to this effort, I can prepare and design better my work to be ready to evaluate things properly. Yeah.
Yeah. Great. Thank you.
From very beginning, you kind of give us what this may not be measurable. Is that right?
Exactly.
Yeah. Okay.
Thank you so much.
Great. Thanks. Anybody else? I mean, if you do have questions, you think, you can always just email them, and we'll be happy to answer. Garrett, over to you.
Garrett Kilroy, evaluation of ADB. Great to get the detail of impact evaluations, and we don't do them so often. Certainly in the independent evaluation, our research division does it. But I was lucky to be involved in one a few years ago on small towns water supply in Nepal, and I got a lot out of it. But actually, sometimes when we want to get the generalizability and the scale up, there seems, within our management and within our institution, there seems to be a preference for systematic reviews as a sort of more powerful, if there are many impact evaluations saying the same thing, that the weight of evidence. Does the panel have a view on systematic reviews? Is that something that your institutions are working on?
Yeah, sorry, go ahead. Who would want to? Yeah. Tara first, and then Chris.
It's a very simple answer. IPA and JPL both produce evidence reviews and systematic reviews. We usually consider RCTs to be the most rigorous and therefore prioritize those findings first. But yeah, it's on a range of topics, and happy to share some with you as well. Yeah.
Thank you. Chris?
Yeah, I think it's our bread and butter. I think, you know, as a researcher, as a lead researcher, we are doing a lot of systematic review because you know, it's part of being capable of understanding the context. And without that, you know, is again, you're risking to shoot in the dark. So there is a lot of background work, including the systematic review, that is definitely the foundation of whatever else.
Yeah. Great. All right. Again, as I'm mindful of the time, and I know that there's a river cruise waiting for people that have already signed up for it, and don't want to keep you waiting. If you do have questions, please just you can email them to me or to the secretariat, and we'll pass it on to the speakers. Look, it's been a very useful session for me, at least, because I'm not an evaluator, so I'm, you know, much of the stuff that I'm hearing is good. I know about public goods and the theory of change and so on. But this has been really helpful. Please join me in showing our appreciation to the three panelists here, plus Svetlana, who couldn't make it. Thank you very much for your time. I do have two requests. One, you have a QR code that is on the tables. Please do scan that. Give us some feedback on any aspect of the session over here. And finally, one last announcement. If you are in the river cruise, 6 p.m. At the ground floor is the rule. And Zeus, anything on dress code? Nothing on the dress code. So thank you very much, guys, and we'll see you in the evening for those of you that are going there.